All right, my people, good morning, good afternoon, good evening once more. We talked about tracking your symptoms as far as memory. Now I'd like you to also consider tracking your progress on day 0, day 30, day 60, day 90, when you start some sort of nutritional supplement, if you've noticed that there's any change in your baseline. So we've all heard that there's certain pathways for neuroprotection, meaning to protect your brain cells from cognitive decline. I'm not saying someone with full-blown dementia, I mean protecting your brain from cognitive decline. And there's so many ways to do it. But one of the things that we might have read about or you may know about is a little bit about methylfolate, which is a bioactive form of folate or folic acid. And without getting into the details of exactly what it does, just remember that it is a neurotransmitter in the brain which transmits information in the brain, and it plays a role in synthesizing a hormone called homocysteine and in the metabolism of homocysteine. Why is this crucial? We found that when people have high homocysteine levels, it is not good for their cognitive health. So L-methylfolate as a supplement can assist in reducing the risk of vascular damage caused by high homocysteine. That includes like atrophy or shrinkage of the brain and overall decline of your cognition or your memory. So that's one of the supplements that can be beneficial if you're trying to make a difference in your brain health. There is also a form of vitamin B12 called methylcobalamin, and it is an active form in the body, so it supports nerve health, supports rejuvenation, it supports synthesis of DNA, it supports production of red blood cells, energy production, and so forth. That too can be beneficial in brain health. So in my next video, we're going to talk more about some other nutritional supplements that you can include in your life that can also help to support your brain health. And remember, if you want to help your brain naturally, you really need to get to the root cause of the problem to prevent brain health, to prevent brain deterioration and cognitive decline. Alright, so L-methylfolate, something to consider. Methylcobalamin, something to consider. Again, L-methylfolate is a bioactive form of folate or folic acid. Methylcobalamin is a form of vitamin B12. So as you can see, B vitamins are pretty crucial in cognition. Have a beautiful day. Dr. Deka Ifobi, keeping it real.